I'm a physician assistant, but also Senior Director of Clinical Field Operations for Isto Biologics. So you all have the Magellan cell concentration device here, and there's a couple of surgeons who are concentrating bone marrow aspirate to saturate bone grafts with perfusion. Just a little quick overview of why they're doing this. There's, the three components needed to get bone growth, the osteogenic, osteoinductive, and osteoconductive piece. The reason they're drawing bone marrow is because it contains the patient's own stem cells, which are osteogenic, meaning they have the ability to eventually turn into bone. And they're typically saturating a graft that is osteoconductive. There's also osteoinductive protein, signaling proteins, cytokines, growth factors in the platelets from bone marrow. So they're getting actually two components with bone marrow aspirate, both the osteoinductive and osteogenic piece that they are then, saturating an osteoconductive graft with. So essentially it replaces the need for harvesting autograft or iliac crest bone, which is what they used to do to get all three of those components. But there was a lot of morbidity with patients having a big chunk of bone taken from their iliac crest. So, there's been a big search for alternatives to that, and this is a great alternative that utilizes the patient's own healing and regenerative cells. I know you're my distributor here. They will be running the machine for you, so I'm not going to in-service you on how to load the device itself. They will be taking care of all that. The only thing that you need to know is how to set up the disposable kit on your sterile tray. Marrow tends to be very sticky. It likes to clot very easily, so there's a couple of sterile trays that come in our kit that you will all be dealing with on the field. It's really important that everything that comes into contact with bone marrow gets saturated with heparin first, or coated with heparin, if you will. So they will go ahead and get the heparin for you. That gets open to the sterile field. This portion of the kit has sterile cups in it, so it makes it real easy to decant your heparin and the anticoagulant that we use for the actual draw into these sterile cups. The setup is probably what takes the longest time. The actual marrow draw itself is pretty quick, but there's an inner tray or outer tray that sits on the top that has a filter. So the reason we filter marrow is because there's oftentimes not only clotting that can happen, but bone spicules get in there, and we don't want necessarily bone spicules in our machine that would clot it off. So the filtering is very important, and that's part of what you will be doing on the field once the surgeon harvests the marrow. They're going to be handing it off to the scrub nurse, and you're going to be filtering it through the filter. So what I have you do is just take out that inner tray, pull out your filter, and there's a little bit of setup required with the filter. You can see there's a clamp at the distal end of it. And in this tray, there's a three-way stopcock with an off lever. So all you're going to do is connect to the distal end of the stopcock. And I will push my off lever to the very end of it, where I'm going to attach the 60 ml collection syringe that comes in the bottom of this tray. So you're going to filter the marrow into the 60. The surgeon is going to be drawing the marrow with two 30 ml syringes because it's less pressure gradient on marrow, which reduces the clotting if you have a less pressure gradient. So they're going to use a 30 ml syringe to draw the marrow. You're going to filter both 30s and into the 60 to give a full 60 mLs. I will use the 12 ml syringe that comes in this tray because you're probably not going to be, from what I understand, the surgeons here aren't gelling the marrow, so there's really no need for this portion of the disposable. But I will use one of the syringes, and I will attach it to this third port here on the stopcock. I'm going to go ahead and have you clamp that clamp on the distal side of the filter. And then what we're going to do is have heparin again decanted onto the field. There are sterile caps. I guess they don't use the sterile caps, so you can get rid of those. But again, everything needs to be now flushed with heparin that's going to come in contact with the marrow. So heparin's going to get decanted into one of these sterile cups. All you're going to do is take your two syringes, your two 30 ml syringes, you're going to draw up your heparin and just go back and forth a couple of times by pulling back the plunger, just to make sure that that syringe gets well coated with heparin. then you can, once you get, you can probably use about 5 cc's of heparin. And so it's just a little bit, but you're just coating with heparin. Once you've done that, I'm gonna have you flush the Jamshidi needle. This is the bone marrow harvest needle. You simply unlock, pull out the stylet, and then you're gonna push your heparin back into the cup. So you're just flushing your trocar with the heparin. Then we'll go ahead and place your stylet back in. And then that'll be ready to go. You're going to now do the same thing with your second syringe and just, again, flush really well with heparin. And with the rest of this heparin now, I'm gonna go ahead and flush my, my filter. Again, everything that is gonna come into contact with marrow, we wanna flush with heparin. So my clamp is closed, so it's gonna give me some pressure here. I'm gonna hold down my plunger while I disconnect, and it's gonna give you a little pop there. But I want the heparin to stay in that filter for a short time. I'm gonna put my cap back on, and what I do is I kind of rock that filter back and forth just to make sure that the heparin gets really well coated on the inside of that filter. Then what you can do is you can unlock your clamp and pull your heparin into this syringe. Once you do that, you switch your off clamp to that syringe so that you're ready to filter into the 60. This is nice because it saves your heparin. If you end up with a really bad clot in that filter, you can disconnect your heparin and run it through the filter again. So it's just kind of a safety net to have your heparin sitting in that syringe for you if you need it. So once that's done, we will load the syringes with the actual anticoagulant that's going to be used for the marrow draw. We don't actually use heparin as the anticoagulant because it has a tendency to drive stem cells down the pathway of becoming adipocytes or fat cells versus bone. We want it to become bone. So we use ACDA, which is a standard anticoagulant in any kit for PRP. It's what they use in blood banking for an anticoagulant. So this is going to get decanted onto the field. They're going to give you about 10 cc's of it. And all you're gonna do is load each of these with 5 mLs of ACDA. And then that's all ready to go. Surgeon's ready, they will take the bone marrow needle, harvest their marrow. They're gonna one syringe at a time. They'll hand off the 30. And all you're gonna do is take that from the surgeon, connect it to your filter, and you're just gonna gently push it through, and at the same time, you can actually start pulling on your 60. And it'll just go right through that filter into the 60. Once this is empty, just disconnect that. You'll be given that second syringe that has marrow. Go ahead and connect that as well, and then push that through. Again, any trouble with clotting and not getting this to come through the filter, go ahead and disconnect your marrow syringe and use your heparin to flush through again. That usually will help to get it through. Oftentimes you can also pinch this and get at least the liquid portion around that clot and get it to come into your 60. Once you've got your full 60 of marrow, you simply disconnect and you're gonna hand that off to Jacob or to Butch or whoever is there running Magellan. And that's it. So I know it's several steps involved, but it's fairly simplistic in that, just making sure that everything is flushed with heparin, load your ACDA, and the surgeon's ready to go. Any questions? And these guys know how to do this, so they can walk you through as well.
Yeah, I'll be there for each of these cases. And as of right now, it's Dr. Santiago will use this, and occasionally Dr. Sadiq. So it's just those 2 physicians right now.
What's that, Jacob? Couldn't hear you.
So as of right now, it's Dr. Santiago and Dr. Sadiq that use this. It's way back there.
All right, that's it. If anybody, I can leave this if anybody wants to play around with it and practice with it. We'll have a demo kit here for you all, and if you have a case coming up, you're welcome to try this non-steroidally.
Does the kit come from materials? or where's the kit?
We have it kept in Butch's Bone Cart. It's out right outside of OR 25. It's this little cabinet that has all his bone graft. We
Okay.
have it on the bottom shelf.
Okay.
Where is like your Magellan machine?
That is usually kept in that little room right outside of 25. It'll be on a big metal